This is OGTV, the People's Telly.
Yes, glad to have you join us on this special interview with Yoruba nurses of North America in Ogun State. Yes, they serve as nurses in the diaspora and they are here in Ogun State. Yes, for one or two programs. I am Moses or Jewumi, and from my immediate right is a nursing professor, Professor Amodupe Akabashon Adibayo. Are you welcome to the program?
Thank you very much. Thank you for having me.
Yes, thanks for coming. And to my immediate left is a registered professional and nurse, Olori Titilayo Additional. You're welcome to the show.
Thank you very much.
Okay, thanks so much. Like I did introduce that Yoruba nurses of North America in Ogun State, and they are here for a program which they tag 2025 Health Mission to Ogun State. Okay, let me start with the nursing professor. You want to educate us or tell us more about this 2025 Health Mission to Ogun State. Tell us more about this mission.
Yeah, thank you very much. So the Yoruba Nurses of North America is a humanitarian organization that was established solely for the purpose of giving back to our communities back home. We are a group of nurses in that practices in North America, United States and Canada, and based on our our exposure, our experiences, so we decided that some of the things that we the benefits of us practicing over there, we may as well just bring it back home and help our people, especially to kind of help with access to basic health care. We do know that healthcare is the service, the delivery is a challenge here. It's not that it's not here, but it's not abundant enough for everybody to benefit the way that they should. So we thought that it's us coming back and doing our own piece just can as well help to boost that.
Okay. Well, thanks so much. Now, Olori Titilayo Additional. I know there are programs. You were here yesterday. You are here today. It seems you have a program on Friday and Saturday. You may want to speak to these programs.
Like today, we actually started the official program today. We started at Ake Palace for the benefits of people living in Abeokuta generally. So we did so much today. We did some health screening. We test people for high blood pressure, diabetes mellitus, breast screening, cancer screening, and awareness. Then mental health counseling and eye testing. So we covered those areas today, and we give so many people health insurance as well. So yeah, that was what we did today. And tomorrow we are doing the same thing as Yewa. And on Thursday, Shagamu and Remo, Ishara, Shakpade area, Ishara, Ode, and Ipara, Iperu. So those localities are going to be covered. Then after that, we proceed to Ijebu Ode area, Ijebu Machine. So these are the areas we are covering, and we are going to provide all these facilities for them as well.
Okay, now, Professor, is this free? Does it come at no cost? The treatments, the prescribed pills?
Yes, it is free, but let me just expand on what my sister said. So we are going to be visiting five locations here in Ogun State. Similarly, we did that last year in Lagos State. We actually covered 7 communities in Lagos State. In 2023, we covered 3 communities in Ife. So what we're doing is basically to kind of reach our people for, especially the underserved areas, and that's why, because if not, we won't be going into different places. We'll just stay, in the major cities, right? But we're actually going in all of the areas where we know that the needs are there. and we know that the needs have not really been met the way they should. So you asked me if it is free. Yes, it is free. We're not charging anyone. What we're doing out of the abundance that God has given us, we're actually contributing our own, little that we have, and then we also ask for people to kind of, support us and, kind of chip in whatever they can, philanthropists and people who are kind-hearted to want to do humanitarian things. Like I said, it's a humanitarian organization, so we're actually, giving back to our community, so it is free. We don't charge. As my sister actually already told you, we screen for common conditions that we know afflict our people, high blood pressure, high blood sugar, and the reason is that, we know that if those conditions are not managed, a lot of them are, they happen so quietly. Even the individuals are not even aware that they are carrying those conditions with them. So, but if without speedy or timely intervention, it can actually lead to complications that are irreversible. For example, somebody with an untreated hypertension can head up with stroke, and then you know what stroke means. It means that it's very debilitating. They may not even be able to function without the help of other people. But can you imagine how it will now affect the caregivers as well? So it's actually a community problem and not an individual problem, and that's why we're coming together as a community to kind of address these issues. So we also do vision screening to see people who may have challenges with sight. So we will give out glasses. Of course, we have doctors there who will also consult and to see if there are needs for those prescriptions to happen. The medications also, we provide the medication. We also do relief, palliative care. We give palliative food distribution. Last year we did gari and rice. This year we actually gave out. Today we gave out packages of rice, and we're going to do that in every city that we visit. In the next 4 days.
That's a whole lot.
Yes.
Now, Olori, so this is a yearly program.
It is.
Okay.
It is yearly, and it's going to continue as the Lord leave it. Yeah. It's not just going to be this year. Like Prof had just said, we started with Osun the previous year before. So last year it was Lagos State, and this is Ogun State. So next year, God's grace, is going to be Ekiti State. And it's not just going to end there. We are still going to cover Oyo State, and Kwara State, Kogi State.
Okay, so it's state by state.
Yes.
State by state.
Okay, so it's the turn of Ogun State.
No, because it's not just Ogun State 10.
Oh, okay.
We cover all Yoruba states. Basically, that's why it's called Yoruba, most of North America.
Okay.
Yeah. So we are basically going to center on Yoruba states alone, including Kwara State and Kogi State.
Mm-hmm. Okay.
Yeah.
Okay. Though they belong North Central,
yeah, but
most of the Yoruba people.
Yeah, exactly. And we cannot just exclude them like that.
Yeah, well, Professor, this is huge.
Can I just add?
Okay, why not?
Yes, we definitely will go to those other areas as well. But as the name suggests, Yoruba nurses. So they say charity begins at home, right? You cannot go and take care of your community if your house is not in order. So that's why we're starting from the Yoruba land, and then we now move gradually to all the other areas. So this is not to say that we're not going to other areas, but we are starting from home, and that's why.
Yeah, well, Olori, so how has it been thus far? You said you're at Aki Palace.
Yes,
today.
We went there, yeah.
For this outreach, the medical outreach. Yeah. So how was the turnout? And for other places you are still going to Shararemo, Jebu Moshin. I mean, speak to them. I'm sure they are watching this program. Perhaps you want them to come out and get numbers. Are you saying you don't care even if 5,000 people?
We are ready for them. Like today, we had a massive turnout, and everyone's needs were met. At least as much as we could. We tried our possible best to see everyone, and they all went home happily. They were very happy. They had their treatment, they had their palliatives, they had their free medical insurance for those that really use it, And we did some caption and everything, and they were actually interviewed by AGTV as well. So it was a massive turnout, and everybody were actually, they went home satisfied. They were very happy, they were very appreciative. So, and we hope to continue.
Okay.
For the whole week long.
Or a week-long program. So
Yeah.
I would like to know what's driving, this passion, the passion to give back to the community, to give back to Nigerians.
Yeah, so as I mentioned earlier on, actually I'm the founder and the leader for the organization. So the practice of nursing itself is a profession where you have to be passionate. The kinds of things that you encounter in the clinical field, you have to love it. So it's not a profession that you just dive into. And so with that comes, the care for the patient. So we actually also advocate for the people that we see. And so part of the advocacy is that those who need the care, but they don't have access. And when we're talking about access, we're also talking about funds. Like being able to fill their prescriptions, being able to even be served, being able to be served, to be served by the medical professionals. So I would say that by setting up the registering the organization, or finding the organization, it actually was born out of my passion to want to help. And the passion to want to advocate for those who are less, the underserved, people who don't have that, who don't have the ability to cover the cost of healthcare. I actually started not here. I started back in the U.S. in Atlanta, where I live. When I went from hospital practice to academia, that was about 8 years. Academia as in teaching in the university. I would go with my students to different communities, African American communities. We would do blood pressure drive. Even during the COVID, we would do shots, like injections and immunization and those kinds of things. And so that kind of then I remember that. We also have we have our Nigerian communities also in the U.S. And when my mom was there, when my mom was there, she actually attended this a mosque, the Nasfat Atlanta. So I remember that the members there, we have like about 2 or 3 sisters came to me and said, you know what, we know that you do this medical the community outreach in the community, but do you want to consider coming to our community, coming to NASFAT, our community, to do it? And so that was the very first community outreach that I did in Atlanta to our people, Nigerians in Atlanta. And so after I did that, then people started saying that, this is something that we can also take home. And so from there, from doing health fairs in Atlanta, medical outreach in Atlanta, it actually morphed into coming home to Nigeria to come and do.
Okay. Then I would like to know the vision and the mission of this medical outreach.
So our vision really is to, like I said, is to be that organization, the humanitarian organization that will help to, join forces with the community, the government, the leaders in the community, to bring access to basic. And we're saying basic. What is basic? It's just things. It's something as easy as getting yourself checked. So that's what so our vision is really to help improve access to basic healthcare in our homeland.
And do you have, is there a collaboration, a partnership with the Ogun State Health Insurance Agency?
Absolutely. So, so this year we're partnering with Ogun State Health Insurance Agency, and the reason is for sustainability, because we can come and screen them for a day, 5 days, and then we are gone. Then what happens to those people who still don't have the fund or the money to access the healthcare, but then we're gone and they're back to square one? Can you consider, for example, if we consider someone who have a chronic condition like high blood pressure, right? I mean, if we see them, we kind of, I mean, like we serve them when we come. We prescribe medication, we give them the medication, but the medication can only sustain them for like maybe about a month. Let's say at the longest a month. Then what happens? You see what I'm saying? So, but to kind of help with that continuity, with that to continue to sustain them, we purchase health insurance for a handful of people, the people that in partnership with the Ogun Health Insurance Agency, they pick those people for us, the ones that they know really need the access. So, and we actually paid from our pocket. We paid 1 year premium. So, and once we've done that. In fact, today, for example, today we paid for 1 year premium for a number of people, and they issued them their insurance card right there today. So with the insurance card, they can seek, service from any of the government institutions around where in their neighborhood, in their community. So that way they can get consultation without having to worry about payments.
Okay. And now, Olori, are you saying you treat all ailments, regardless, people should come?
Yes. For minor ailments.
Okay, minor.
No, I'm just starting with that. We treat all. So for for minor ailments, we treat like malaria. We treat now and then. They get their treatment and they go. For some people that need long-term care, those are the ones that are benefiting from the healthcare insurance, and when we ensure that they can't actually afford the continuity of care, so we provide them with this health insurance card, and they connected it to there. So with those kind of people, there's continuity of care, and they have peace that at least they'll be able to continue taking the medication. There's some people, they prescribe for them. They take medication, they take the first course, then subsequently they stop because they couldn't or they can't afford to purchase the medication. These medications are actually expensive. And then we feel for them, to be honest. But there's some of these medications actually, like over there, they are free for people with long-term illnesses. So they're actually supposed to be free, but they are not free. Maybe we'll come to that towards the end of the program, I don't know. Whereby we are employing the government to just come to people's aid and then just give more. There's some medication that there's some treatment that people need support with. Like pensioners, how much are they earning? And they have these ailments. And the anxiety they have because they couldn't afford to buy this medication is killing enough to kill anyone. So we just implore the government to please support people more, especially they should take healthcare as priority because it should be priority. But these are basic human needs, So that's where we're coming in, and we are willing to work with them. We just need their support, we need their cooperation, and for people, giving is a spirit.
Yes.
It's a passion. So if you have passion to help others, and you can afford, like you have 2 or 3 things, and you just feel like they're just lying in the wardrobe, you are not using them, give them out to people that needs them. At the end of the day, they will all get to us if you don't even use them. So I'm just citing an example in that aspect. So people that have passion to support others, we should support us. We need more of these people to support us and join us if possible, if you don't mind.
Okay.
Yes.
Okay. Well, Professor, you want to speak more to that?
Yes, please. Yes. Like Olori explained. Yes, we can only do as much as we can with the little fund that we have. So again, because a lot of even the medical supplies, the equipment, and everything, they are all self-funded, which means we actually contribute money to do that. But with that being said, we've actually we've had a lot of people who have also chipped in, donated and funds and those kinds of. In fact, even not, I mean, not all the donors, gave fund, but some even, kind, and maybe there are also some services that they offered. Case in point, Our Excellency, the First Lady of Ogun State, she's been very, very helpful.
Yeah,
and she's been phenomenal. Mrs. Ramdele and Abiodun, she's been very, very helpful. She has really supported us in, on this our mission. She's been very, very helpful with regards to even our movement, transportation, and those kinds of things. So and many things that she has contributed. That I cannot start to name everything, but she's been very instrumental in us, being able to do this. Also, our father, the royal father, Alake of Igbaland, he actually gave us his part. Exactly. But can you imagine if we have to pay for that venue, for that location? It's very, it will be very pricey. But the KBC gave us that place, freely for us to use. So those are just examples of how people have really supported. There are so many other things with regards to logistics that people have supported us with, and we're very grateful. But we're also asking for, for other, individuals who may have, maybe one or two things, or even, they have, they have that philanthropic heart, and they have the kind heart to want to help us to make this even a better success.
At time is fast spent.
Yes.
I wanted to know, is surgery part of the medical outreach for those?
No, surgery is not. So like we said, basic care. So basic care will start with which is primary care, like checking people for normal, for major conditions, those kinds of things. And so because those are things that we can treat in the community, because if you want to do surgery, you have to go into it's an inpatient, then you have to go into the hospital or something, they book you, and so we're starting with basic care, but by the grace of God, we can, we're gonna go, gradually. But you see, if you can take care of the primary care, then secondary care is really, that's what it is, secondary.
Okay.
See what I'm saying? Okay. So if we can arrest those things primarily, they won't need surgery, will they?
Okay.
See that?
Okay. Well, our time is fast spent, but very quickly, let me take you out of the scope of this medical outreach, and let's talk about brain drain. We'll say Japa syndrome, which is one of the problems affecting Nigerians in the healthcare sector. So what would be your advice to that young nurse?
Well, to the young nurse, Japa syndrome started for a reason, to be honest. Because in those days, there were no professionals, let me put it that way, professional nurses, doctors, they were like working out of frustration. Most of the times we improvise things, equipment, we boil even needles and syringes. It was that bad. So we were working under that frustration. The wages was not home about. The environment,
things are getting
conducive.
better. Things are getting
better.
Yes.
Right? So, Japa syndrome, on its other hand, has a positive outcome, which is one of the...
What are you doing right now?
Exactly.
Okay.
Because we learn more there. Even in our approach with patients and everything, you know your limit, you know your boundaries.
Yes.
So, all those experiences there, we brought them back home. I will pass them on to our younger colleagues.
Okay.
Yes.
So
it has helped in a way. But for the young nurses too, we won't pay for our healthcare to collapse. I'm sure Nigeria is getting there. Our country is getting there generally. Yoruba states are getting there. So the patients, I would think government should come, an agreement with them to say, okay, even if you are going to leave, just serve your country a bit, like we did.
Oh, like you did. Okay.
Exactly.
Serve your country for like 5, 7 years. Thank you.
That was a bit too long for many people.
I know there was a time that bit came up, but Nigerians.
At least minimum of 2 years.
2 years. Okay, well, we have to go now. Many thanks, Olori Titilayo, additional registered professional nurse and of course the nursing professor in the studio, Professor Mudupe Akabashorun Adibayo. Thanks so much. Yes. So nurses, Yoruba nurses of North America in Ogun State. Yes, they are right here in Ogun State, and today they were at the Alaki Palace. Yes, at the amphitheater, basically. Yes, attending to the needs, to the health needs of residents in the state, of some residents. And on Friday, they are off to Ishara, Remo. Then on Saturday is the turn of Ijebu, Mushin. So if you are living around these places or in these places, why not? To Ilaro tomorrow. So that's it. Many thanks. Yes. And thanks for all you do. Thanks for giving back to the community. And so that's it. So that's we come to the end of this special edition with Yoruba nurses of North America. And we do say best of luck in all they do. Bye for now.